Good day, everyone. We are here today to discuss electrolyte imbalances and acid-base balance. So first, let us talk about what is electrolyte imbalances. So electrolyte imbalance occurs when there is an excess or deficiency of electrolytes in the body. So ang electrolytes ay nagtataglay ng electrical charges na siyang tumutulong para mag-function ng ating katawan. At para din ma-maintain natin ang balanse ng tubig sa ating buong katawan. Okay, so next slide. So here's the content of our topic. We have here the electrolyte imbalances. We have the hypernatremia, hyponatremia, hyperkalemia, hypokalemia, hypercalcemia, hypocalcemia. Then we have here the acid-base balance, the respiratory acidosis, alkalosis, metabolic acidosis, and alkalosis. Next slide. So the hypernatremia and the hyponatremia is a sodium imbalance. So when we say sodium imbalance, it is a condition where the levels of sodium in the body are too high. That is what we call the hypernatremia, or too low, and that is what we call hyponatremia. So ang sodium is an essential electrolyte that plays a vital role in maintaining fluid balance, blood pressure, and nerve muscle function. So let us dig deeper about what is hypernatremia. Okay, so next slide. So a hypernatremia is a condition in which the child has the high amount of sodium in the blood. So hypernatremia is an electrolyte imbalance consisting in rise in serum sodium concentration, a medical condition characterized by an abnormally high concentration of sodium in the blood. It is a serious condition in neonates and can lead to seizures, coma, and even death if left untreated. So, in simple words, mataas po ang sodium level sa dugo. So, to explain it further, so imagine a cell. So, in the cell, we have the intracellular fluid and the extracellular fluid. In this case, there is a high concentration of sodium in the extracellular fluid. So ang nangyayari, lahat ng tubig doon sa intracellular fluid ay lumalabas o pumupunta doon sa extracellular fluid. Kasi nga, madaming sodium doon. 'Di ba ang water loves sodium? At isa pa, mataas ang concentration dun sa extracellular fluid kaya pumupunta doon si water. 'Di ba nga, we have the process of osmosis where an area of lower concentration will moves or will try to moves to an area of higher concentration. So ang nangyayari, nade-dehydrate si cell kasi nga wala ng water sa intracellular fluid. So as a result, there is a shrinkage of cell. That is when nagkakaroon or it will leads to seizures, coma. And the other reason is also the changes of the concentration of electrolytes in the cell. Next. So these are the signs and symptoms in neonates. Poor feeding, irritability, restlessness, high-pitched crying, lethargy, seizures, sunken fontanelles, dry mouth and tongue, decreased urine output. So, ma-observe natin sa signs and symptoms na parang same lang siya sa dehydration, pero mas grabe. Next. So, these are the causes of hypernatremia in neonates. Inadequate breastfeeding or formula feeding. So, dito, in-advise natin si mother to breastfeed their child 8 to 12 times in 24 hours to have plenty of fluids in their body and to avoid dehydration. preterm birth, dehydration, infections, medications, and we have here the congenital adrenal hyperplasia or hyperplasia. Ito naman, it refers to a group of genetic disorders. So, genetic disorder siya, meaning namamana siya. Um, this condition affects the adrenal glands, causes the body to produce an insufficient amount of cortisol. Okay, next.
Sorry.
So these are the nursing interventions. Monitor fluid intake and output. Encourage increased fluid intake, administering IV fluids as prescribed. Assessing vital signs and electrolyte levels. Monitoring for signs of dehydration, assessing feeding and providing support to improve feeding. So self-explanatory naman na po. Next. So on your screen is a different lab test that can confirm if the child has or should I say the child is a hypernatremic or not. It also includes the normal range of values. Next. Next. Next slide.
Next doc. Okay.
Sa pharmacologic intervention. So here are the pharmacologic intervention. IV fluids such as dextrose in water or normal saline. Ito naman to avoid dehydration. Diuretics. So it helps your kidneys to release more sodium into your urine. So di ba nga sa hypernatremia madaming sodium. So diuretics, it helps the kidneys to release more sodium. Medications to treat underlying conditions such as antibiotics for infections. Next. So ito naman po yung dapat na i-health teaching natin. The importance of early and adequate feeding to avoid dehydration. Signs and symptoms of dehydration and hypernatremia para aware sila. Follow-up care with a healthcare provider. Proper preparation of infant formula if applicable. Next. Ito naman po yung therapeutic management. Treating the underlying cause, replacing fluids and electrolytes, monitoring vital signs, and electrolyte levels, administering medications as prescribed, providing supportive care. Okay, next. So we have here the pathognomonic feature of hypernatremia in neonates. So ang pathognomonic features niya is a serum sodium level greater than 150. So kapag yung pag lumabas sa lab result ng na ang serum sodium level sa kanyang dugo ay greater than 150 milliequivalent per liter is considered as hypernatremia. So that next. Next. So that concludes or that is all about hypernatremia. We'll now go to hyponatremia. So from the word itself, hypo means mababa. So a hyponatremia is defined as sodium concentration lower than 135 milliequivalent per liter. It is a medical condition where the concentration of sodium in the blood is lower than normal. So dito sa hypo naman, yung concentration of sodium in the blood is lower. compared sa hypernatremia na mataas. So, in simple words, mababa ang sodium concentration sa dugo. Ang nangyayari naman dito ay nagkakaroon ng excessive amount of water in the cell. Dito naman, ang concentration sa extracellular fluid ay mababa compared sa concentration na meron sa intracellular fluid. So, as a result, lahat ng water ay pumupunta sa intracellular fluid because mababa nga ang concentration sa extracellular fluid. So, here, the cell swells because of the high amount of water inside the cell. So, nagsiswell po yung cell natin dito. Next slide. So, here are the signs and symptoms in neonates. Irritability, poor feeding, lethargy, seizures, and coma. Next slide. So, here are the causes. Excessive water intake. So especially when the amount of water intake exceeds that of water excretion in the kidney. As a result, the sodium concentration in the blood is diluted. So fluid losses such as from vomiting or diarrhea. Pwede din due to excessive fluid loss. Medication such as diuretics. So di ba nga ang diuretics, it helps the kidney to release more sodium. So dito, mababa na nga ang sodium level, ilalabas mo pa yung iba. So, yun, kaya nagkakaroon ng nagkakaroon ng excessive amount of water. Then, kidney disease. So, as a result, the kidneys will have the hard time to get rid of extra fluid from the body. Then, lastly, the syndrome of inappropriate antidiuretic hormone secretion. So, dito naman, it happens when our body makes excess amounts of antidiuretic hormone that causes our body to retain too much water. Next slide. So, we have here the nursing interventions. Assessing the neonate's fluid and electrolyte status, monitoring neonate's vital signs including blood pressure and heart rate, administering IV fluids and electrolytes as ordered, restricting the neonate's fluid intake as necessary, monitoring the neonate's urine output and fluid balance, assessing neonate's mental status and neurological function regularly. So mapapansin natin sa nursing interventions ng both sa hypernatremia and hyponatremia, mas nagfo-focus sila sa excretions of fluids, 'di ba? Kasi nga, yun. So, ano na, gets nyo na. Gets nyo naman, 'di ba? So, yun, nagfo-focus sila sa more on fluid excretion ng isang tao. So, ito naman yung mga lab test na pwede gawin para ma-determine kung may hyponatremia ka. So, it also includes the normal level of each test. So, next. Pharmacologic intervention. A pharmacologic intervention for hyponatremia in neonates depends on the underlying cause of the condition. In some cases, medication may not be necessary and hyponatremia can be managed by fluid restriction or IV fluids. So in cases where medication is necessary, the following drugs may be used: hypertonic saline, demeclocycline, vasopressin receptor antagonist. So sa hypertonic saline, this is a concentrated salt solution that's given IV to increase serum sodium levels. So dito, it increases the serum sodium levels to balance the amount of water and the sodium in the cell. So the demiclo- demiclocycline, it blocks the action of antidiuretic hormone which can help correct hyponatremia caused by SIADH. So dito naman binablock niya si antidiuretic hormone. So, vasopressin receptor antagonist. It blocks the action of antidiuretic hormone which can help correct hyponatremia caused by. So, parang same lang sila ni demiclocycline. Next slide. So, ito naman yung dapat na i-health teaching natin. The importance of following a low sodium diet. The importance of monitoring the infant's fluid intake and output. The signs and symptoms of hyponatremia. The importance of taking their infant's medication as prescribed. And the importance of regular follow-up appointments. Next slide. So here are the therapeutic management. The therapeutic management in units depends on the underlying cause of the condition. In general, it includes correcting fluid and electrolyte imbalances, monitoring the infant's vital signs, and treating any underlying medical conditions. So, same lang din sila sa hypernatremia. The therapeutic management depends on the underlying cause of the condition. So, nagdedepende pa din sa kung anong cause ng sa anong cause ng condition nila. Next. So, the pathognomonic features. So, there are no pathognomonic features specific to hypernatremia in neonates. However, the presence of seizures or coma can be indicative of severe hyponatremia and can prompt immediate medical attention. So, dito sa pathognomonic features, pwede naman din natin sigurong ilagay si si below 135 milliequivalent liter sodium concentration sa blood as a pathognomonic features of hyponatremia. Kasi it is the only indication na may hyponatremia ang isang tao. So, ito naman sa seizures and coma na nakalagay, severe hyponatremia na siya. Parang hindi na siya nalaman agad. Parang bigla na lang na nag-seizures or coma. Yun pala, hyponatremia na pala. Okay, so that's the end of my report. Thank you for listening. So, I am now passing the virtual floor to Jeline Rifuya to discuss the potassium imbalance. Thank you.
Okay, so now let's move on to our next topic, which is the potassium imbalance. So when we say potassium imbalance, nangyayari ito kapag abnormal na yung pagtaas or pagbaba ng potassium level sa ating katawan. So kapag nangyari ito, magkakaroon ng tinatawag na hyperkalemia or hypokalemia. So bago natin alamin kung ano nga ba ang meron sa hyperkalemia at hypokalemia, alamin muna natin kung bakit nga ba nagkakaroon ng potassium imbalance sa mga baby. So neonates develop a potassium imbalance as a result of vomiting or pagsusuka, diarrhea, pagpapawis at pagtake nila ng mga gamot gaya ng diuretics at laxatives. So dahil sa mga nabanggit ko kanina, tumataas or bumababa yung potassium level ni baby. So dahil din sa mga to, nade-dehydrate din sila, which is nagli-lead sa hyperkalemia and hypokalemia. So vulnerable ang mga baby into dehydration kasi meron lang silang small size and mabilis lang yung kanilang metabolism. So alam naman natin na ang potassium is essential mineral that is required for the proper functioning of many organs and systems in the body, gaya ng heart, kidneys, and muscles. So it has also a potential role in metabolism. So nagre-regulate din ito ng acid and water in the blood and body tissues. So it also helps in building muscles and it supports normal body growth. Kaya importante ang potassium hindi lang sa mga matatanda kundi pati na rin sa mga babies. So yun nga, gaya ng sinabi ko kanina, potassium imbalance can lead into various health problems such as hyperkalemia and hypokalemia. So now let's discuss the hyperkalemia. So next slide. So hyperkalemia in neonates are somewhat called as neonatal non-oliguric hyperkalemia. So it happens when the serum potassium concentration is greater than the normal. So ibig sabihin, na-reach niya yung upper limit of normal potassium level which is usually greater than 5.0 milliequivalent per liter or to 5.5 milliequivalent per liter. So, nagkukos din ng life-threatening cardiac arrhythmias, muscle weakness, or paralysis ang pagkakaroon ng mild hyperkalemia. And yung mga sintomas is nagda-develop kapag yung potassium level is nag 6.5 milliequivalent per liter or 7 milliequivalent per liter. So, common yung hyperkalemia sa mga low birth weight infants or yung mga batang ipinanganak ng may mababang timbang. So, ito yung pinaka-serious na electrolyte abnormalities because it can cause fatal arrhythmias. So, when we say fatal arrhythmias, it is the significant change in your heart rhythm. Ibig sabihin, your heart is not able to pump blood efficiently. So, yung hyperkalemia is a common complication sa mga newborn in the first 48 hours of life in very low birth weight. So, next slide. So, ano nga ba yung mga signs and symptoms ng hyperkalemia? Kung makikita nyo, meron tayo ditong word na murder. So, muscle weakness. So, pag weak yung mga muscles ni baby, maaaring may sintomas na siya ng hyperkalemia. Next is urine, oliguria or anuria. When we say oliguria, it is a low urine output. Pag anuria naman, no urine output. And next is respiratory distress. So, yung respiratory distress naman is nangyayari kapag yung lungs ni baby is not fully developed and it cannot provide an enough oxygen na nagkukos ng hirap sa paghinga. So, nangyayari din ito sa mga maagang ipinanganak or kulang sa buwan or yung tinatawag nating premature babies. Next is decreased cardiac contractility. So, dito naman sa decreased cardiac contractility, nagkakaroon tayo ng tinatawag na myocardial failure, which impairs the pumping ability of one or both ventricles. Next is ECG changes. And meron din tayong reflexes, hyperreflexia or areflexia. When we say hyperreflexia, it is an exaggerated velocity-dependent stretch reflexes. And then yung areflexia naman, absence of deep tendon reflexes. Okay, so these are the signs and symptoms of hyperkalemia. Next slide. So now let's move on to the causes. First is kidney dysfunction. So dito sa kidney dysfunction, the kidneys do not work as well as they should. And then next is excessive potassium intake or sobra yung potassium sa dugo. And then certain medications, renal failure or renal tubular acidosis. And we also have the excessive potassium intake from parenteral nutrition or potassium containing medications. So one of the examples of potassium containing medication is potassium chloride, and which is used to treat and prevent the low blood potassium levels or hypokalemia na matatakal natin mamaya. So what are the next slide? So what are the lab tests na kailangan for hyperkalemia? First, we have the serum electrolytes. Next is creatinine, blood urea nitrogen, spot urine test, transtubular potassium gradient, and trial or oral fludrocortisone. So next slide. So for the nursing intervention, we have to monitor the neonate's vital signs and symptoms. Pag severe na yung case, the neonates may require respiratory support, cardiac monitoring, and immediate intervention para maiwasan ang complication. So then of course, nurses must also ensure the neonate's fluid and electrolyte balance. Kailangan na-maintain within the normal range. And the neonate's nutritional needs are met. So next slide. So what are the pharmacologic intervention for hyperkalemia? So yung pharmacologic intervention for hyperkalemia is nakadepende sa kung gaano ka-severe yung condition ni baby. Pag mild lang yung case, dietary modification lang. Ibig sabihin, magkakaroon lang tayo ng changes sa food preparation, processing, and consumption. Pag severe naman yung case, nagre-require na ng medication administration. Meaning to say, kailangan na ni baby ng gamot or it's either injection, inhalation, or others. So yung common na medication for hyperkalemia in neonates is insulin, glucose, and sodium bicarbonate. Sa ibang cases naman, diuretics and potassium binding resins are prescribed para mapababa yung serum potassium level ni baby. Okay, so next slide. So we have the health teachings. We need to educate the parents or caregivers about the condition and its management. They should be aware of the signs and symptoms of hyperkalemia, as well as the importance of seeking prompt medical attention if they suspect their baby has the condition. So, kailangan din nilang ma-educate about sa mga dietary requirements na kinakailangan ni baby and also the importance of adhering to any medication regimen prescribed by the healthcare provider. So, next slide. We also have the therapeutic management for hyperkalemia. First is treating the underlying cause of the condition, maintaining fluid and electrolyte balance, and preventing complications. So, pag severe na yung case, required na ng hospitalization para sa respiratory support, cardiac monitoring, and IV medications. So, yung mga baby is, yung mga baby na may chronic kidney disease, nagre-require na ng ongoing management and kailangan i-monitor para maiwasang magkaroon ng hyperkalemia. So, next slide. Okay, so let's discuss the hypokalemia. So kabaliktaran lang nito yung hyperkalemia. Kasi kung yung hyperkalemia is yung serum potassium level ng baby is mataas sa normal, dito naman sa hypokalemia, from the word itself, hypo means low. So this is the medical condition wherein the potassium levels in the blood are lower than the normal. So pag sa mga baby naman, hypokalemia can lead into a serious health complications. So nagkakaroon ng tinatawag na hypokalemia sa mga baby kapag bumababa yung serum potassium level into 3.5 milliequivalent per liter. So, next slide. Let's see for the signs and symptoms. So, nakadepende din yung kung gaano ka-severe yung condition ni baby sa sintomas nito. So, pag severe yung case, it can lead to life-threatening complications. So, the symptoms are muscle weakness, lethargy, poor feeding, constipation, and respiratory distress. So, when we say respiratory distress, ito yung nangyayari pag hindi pa fully develop yung lungs ni baby. So, ibig sabihin, pag hindi pa fully develop yung lungs ni baby, na hindi pa siya nakakapag-provide ng enough oxygen which can cause breathing difficulties. Usually, ang nakakaranas nito is yung mga premature babies. So, pag severe cases naman, hypokalemia can cause cardiac arrhythmia, including tachycardia, atrial fibrillation, and ventricular fibrillation. Pag sinabi nating tachycardia, umaabot na sa 230 beats per minute yung heart rate ni baby. So it can cause by an additional electrical pathway within the heart. When we say atrial fibrillation naman, it is a disorganized and rapid atrial activity with atrial rates ranging from 350 to 600 BPM. While ventricular fibrillation occurs when the electrical signals that tell your heart muscles to pump cause your ventricles to quiver. So these are the signs and symptoms of hypokalemia. So dumako naman tayo sa causes nito. So first, we have the gastrointestinal losses. So ibig sabihin, may problema si baby sa digestive tract. Next is renal losses. Nangyayari naman ito when the kidney of the baby lost its filtering ability. Ibig sabihin nito, yung mga dangerous na waste is ma-accumulate and the baby's blood chemical makeup may get out of balance. So we also have the inadequate intake of potassium. So yung mga baby na may cystic fibrosis, diarrhea or congenital adrenal hyperplasia is at risk sa hypokalemia. So when we say cystic fibrosis, si baby ay may makapal at sticky mucus that builds up in the body. When this mucus builds up in the lungs, binablock niya yung airways which can cause breathing problems and infections. So, kapag may cystic fibrosis si baby, habang palaki siya ng palaki, lung infections will get worse. And when we say congenital adrenal hyperplasia naman, it is the inherited disorder that affects the production of hormones na nagkukos sa adrenal glands to become too big or hyperplastic. So yung mga baby na may low birth weight or premature is at risk din sa hypokalemia due to immature kidneys and inadequate potassium intake. So next slide. So what are the lab tests for hypokalemia in PEDIA? Of course, unang-una dyan yung serum potassium level test. And the normal range for serum potassium levels in neonates is nasa pagitan ng 3.5 at 5.5 milliequivalent per liter. So, nakadepende din sa taon at medical history ni baby. So other laboratory tests includes arterial blood gas analysis, CBC, and renal function test. So yung arterial blood gas analysis is a test to characterize the type of disorder, quantify the magnitude, and assess the nature and extent of compensation. So, what are the nursing interventions naman for hypokalemia? Next slide. So, the nursing interventions for hypokalemia is unang-una dyan to monitor the vital signs and symptoms of the baby. Gaya din sa hyperkalemia, pag severe na yung case, the neonate may require to have respiratory support, cardiac monitoring, and immediate intervention para maiwasan yung complication. So, it is also important na i-ensure kung na-maintain ni baby yung fluid and electrolyte balance within the normal range. And of course, we have to check if the nutritional needs of the babies are met. So, next slide. So, let's go now to pharmacologic intervention. Gaya din sa hyperkalemia, nakadepende din yung pharmacologic intervention sa kung gaano ka-severe yung case ni baby. Pag mild cases, dietary modification. Pag severe cases, medication administration. So, um, yung common na medication for hypokalemia is pot, um, So, pag mild cases, dietary modification. Pag severe cases, medication administration. So, yung common na medication for treating hypokalemia is potassium supplements, potassium sparing diuretics, and oral dehydration solutions. So, example ng potassium sparing or sparing diuretics is amiloride. So, it is used to lower high blood pressure para maiwasan ang stroke, heart attack, and kidney problems. So, sa ibang cases, IV potassium replacement therapy may also be necessary. So, next slide. So, dito na tayo sa health teachings. Parehas lang din sa hyperkalemia. So, kailangan ni-educate yung parents or caregiver about sa condition ni baby. So, kailangan aware din yung parents or caregiver sa mga signs and symptoms of hypokalemia. And yung importance of seeking medical attention pag napansin nilang may hypokalemia si baby. So, kailangan din silang ma-educate about sa dietary requirements ni baby and the importance of adhering to any medication regimen prescribed by the healthcare provider. So, dito, next slide. So, dito naman tayo sa therapeutic management. So, pareho lang din sa hyperkalemia. Basta ang tatandaan lang natin is kapag severe na yung case, neonates may require a hospitalization for respiratory support, cardiac monitoring, and IV medication administration. Okay, so that's all for hyperkalemia and hypokalemia or potassium imbalance. So we have here Jonabel Abando to discuss the next topic, which is the calcium imbalance.
Next is calcium imbalance. So, calcium is an essential mineral that is necessary for various bodily functions, including bone growth and muscle function. So, calcium imbalance refers to a situation where there is an abnormal concentration of calcium in the body. So, a calcium imbalance can occur when there is too little calcium in the body, which is hypercalcemia, or too much calcium in the body, which is hypocalcemia. So, hypercalcemia, so this condition occurs when calcium levels in child's blood become too high, or when the calcium level is above normal, and it can cause symptoms and potential complications. So, hypercalcemia can occur in very young infants due to excessive vitamin D action that occurs as a result of injury to skin or fat tissue or from genetic conditions. So, it means kung mayroong damage sa balat o taba sa katawan ng baby, pwedeng makapasok ang sobrang daming vitamin D sa kanyang system. And maaari ding maging dahilan ang hypercalcemia kung mayroong genetic condition ang baby na nagpapataas ng kanyang sensitivity sa vitamin D. So, alam naman natin na vitamin D is a pro-hormone that helps the body absorb calcium. So, kapag mayroong sobrang dami ng vitamin D sa katawan ng baby, is maaaring magdulot ito ng pagtaas ng calcium sa blood. And this is what we call the hypercalcemia. Next slide. So, signs and symptoms. So, ang sobrang daming calcium sa dugo is maaaring magdulot ng mga signs and symptoms like vomiting, poor feeding, lethargy, irritability, constipation, dehydration, failure to thrive, hypertension, weakness, muscle cramps, and seizures. So, if the baby has these signs and symptoms, you need to consult a doctor for diagnosis and proper treatment. Next slide. Causes of pediatric hypercalcemia. So first is hypervitaminosis D, or ito is nasobrahan ng vitamin D yung baby and it leads to calcemia. Second is familial hypoculturic hypercalcemia. So this is a genetic disorder na nagdudulot ng pagtaas ng level of calcium sa blood ni baby. So in this kind of condition, ang mga baby ay may defect sa kanilang genes na nagkukos ng incorrect signaling or hindi tamang pagpapadala ng signal ng calcium sa kidney ng baby. This results in the kidneys retaining too much calcium instead of releasing it into the urine. So dahil dito, hindi nagagamit ng wasto ang calcium sa katawan at ito ay nanatili sa kanilang blood na nagdudulot ng hypercalcemia. Third is milk alkali syndrome. Ito is kapag ang mga bagong panganak or neonate ay umiinom ng maraming gatas na isa ring cause ng hypercalcemia. Last is neonatal hyperthyroidism. So, the main function of the parathyroid glands is to make the parathyroid hormone. Then, ang main function naman ng parathyroid gland ay mag-regulate ng calcium sa katawan. So, kapag ang mga parathyroid gland ay nagpo-produce ng sobrang dami ng hormone, is nagre-result ito ng pagtaas ng level ng calcium sa dugo ni baby, leading to hypercalcemia. Next. So, sa lab test, meron tayong serum calcium level. So, ang normal level ng lab test na ito is 8.5 hanggang 10.2 milligrams per deciliter. So, pag ang serum calcium level is greater than 11, it is considered a hypercalcemia. Next is ionized calcium level. So, the normal level of this lab test is 4.64 to 5.28 milligrams per deciliter. If above normal ang result, this is called hypercalcemia. Third is parathyroid hormone. Kung mataas naman ang antas ng parathyroid hormone sa dugo is maaring ito ay dahil sa primary hyperthyroidism. So, sa kabilang banda, kung mababa naman ang level ng parathyroid hormone level ay nagpapaiwatig ito ng hypercalcemia. So, last is 25-hydroxy vitamin D. Ito ay isang pinakamahalagang test sa pagtukoy ng hypercalcemia. Kung sobra ang level ng test na ito sa dugo is maaring dahilan ng pagtaas ng level ng calcium sa blood ni baby. Next. So, nursing intervention. Monitor vital signs. Second is provide adequate hydration. Third is administer medications. So, the nurse should administer medications as prescribed, such as caltonin, bios, bisphosphonates, or diuretics to lower calcium levels and manage symptoms. And monitor fluid and electrolyte balance. And we need to educate the parents. And last is document care. Next. Pharmacologic intervention. So, first is the caltonin. So, caltonin is a hormone na nagpapababa ng blood calcium level. So, this can lower blood calcium levels sa pamamagitan ng pagpigil ng bone resorption and promoting renal excretion of calcium. So, in this way, caltonin can help to maintain the balance of calcium in the body of the baby. Second is diuretic. So, nagpapababa ng sobrang tubig at asin sa katawan. So, sa pamamagitan ng ng sobrang katawan, nagbabawasan rin ang concentration ng calcium sa dugo. Third is glucocorticoids. Ito ay mga uri ng steroid hormones na maaaring magpa-lower ng level of calcium sa dugo. Ito ay ginagamit kung merong underlying medical condition na nagkukos ng hypercalcemia. Last is phosphate binders. Ito naman is mga gamot na nakakatulong sa pagdikit ng phosphate sa blood upang maiwasan ang pagbuo-buo ng calcium na nagkukos ng hypercalcemia. So, that's all for hypercalcemia. Next is hypocalcemia. So, hypocalcemia occurs when the level of calcium in units blood is low. Hypocalcemia in units is a condition where there is an abnormally low level of calcium in the blood of newborns. When calcium levels in the blood becomes too low, it can lead to a range of symptoms and potential complications. Next. Next is signs and symptoms. So, signs and symptoms of neonatal hypocalcemia rarely occurs unless ang total serum calcium ni baby is mas mababa sa 7 milligrams per deciliter o kaya naman ang ionized calcium level ni baby ay mas mababa sa 3.0 milligrams per deciliter. So, if the baby have symptoms of hypocalcemia, we need to consult a doctor for diagnosis and proper treatment. So, it can cause signs such as hypotonia, tachycardia, tachypnea, apnea, poor feeding, jitterness, tetany, and seizures. Next. Next is the causes. So, premature neonates with low birth weight may have underdeveloped organs, including yung mga glands na nagpo-produce ng hormones na kailangan to control calcium levels in the body. So, these factors ay makaapekto sa kakayahan ng baby na mag-absorb, regulate, and mag-release calcium sa kanilang body. Sa causes. So, the causes is premature neonates with low birth weight. So, premature neonates with low birth weight may have underdeveloped organs including yung mga glands na nagpo-produce ng hormones na kailangan to control calcium levels in the body. So, these factors ay maaaring makaapekto sa kakayahan ng baby na mag-absorb, regulate, and mag-release ng calcium sa kanilang body. And same as the medications such as furosemide and phenothione. So these medications ay maaaring makaapekto din sa ability ng kanilang katawan na mag-absorb ng calcium mula sa pagkain o mag-release ng calcium mula sa katawan. Next is lab test. So meron tayong serum calcium level, ionized calcium level, and parathyroid hormone level na same lang din sa natakal kanina sa hypercalcemia. So fourth is magnesium level. So ang level ng magnesium sa body ng neonate is kailangan matest para malaman if may hypocalcemia si baby. For example, kung ang isang neonate ay mayroong prematurity, maaaring maging mababa ang level ng magnesium nito sa katawan. So kapag mababa ang level ng magnesium, maaaring maka-affect ito sa proper utilization o tamang paggamit ng calcium sa body at mag-cause ng hypocalcemia. Lastly is phosphate level. So ang normal na level ng phosphate sa neonate is nasa pagitan ng 4.5 hanggang 7.5 milligrams per deciliter. If mas mataas ang result ng lab test na ito, it can lead to hypocalcemia. Next. Next is nursing intervention. So monitoring the and symptoms to assess their condition. Next is providing support such as frequent feedings and skin-to-skin contact. So this can help to maintain the neonate's condition and reduce their stress levels. Administering calcium supplements as prescribed by the healthcare providers. So calcium supplements can improve the condition of neonates with hypocalcemia. It is important to follow the healthcare provider's prescription to ensure the correct dosage of medication. And lastly is educating parents about the condition and how to manage it at home. Next. Next reporter will be Laika Ison.
So, next is the acid-base balance. So, let's talk about the acid-base balance um, that refers to the equilibrium or the balance between the acid and the bases or the alkalis in the body. So, the human body works best when there is a delicate balance between acidity and alkalinity. So our body maintains the acid base balance through various mechanisms such as buffering systems, respiratory regulation, and renal regulation. So the buffering systems involve the use of substances that can either accept or donate hydrogen ions to maintain the pH within its normal range. So the respiratory regulation involves the control of carbon dioxide levels in the blood by the lungs. So when carbon dioxide levels increase, the body increases respiration to eliminate the excess carbon dioxide and decrease acidity. So, when carbon dioxide levels decrease, respiration decreases to conserve carbon dioxide and maintain its acidity. So, the renal regulation is it involves the control of acid base balance by the kidneys, which is the base. So the kidneys can either excrete or retain hydrogen ions and bicarbonate ions to maintain acid base balance. So in this acid base balance topic, disruptions of it can lead to acidosis or the excessive acidity, or the alkalosis or the excessive alkalinity. So these conditions can have a range of causes that includes respiratory or metabolic disorders, um, medication use, and certain diseases. So each treatment depends on the underlying cause and may involve medication or lifestyle changes or other interventions to restore its balance. So let's um, let me let me discuss you what respiratory acidosis is. So, respiratory acidosis is the abnormality that results from an imbalance between production of carbon dioxide by the body and its excretion by the lungs owing to inadequate minute ventilation. So in infants, infants can develop respiratory acidosis when they are unable to effectively eliminate carbon dioxide from their bodies due to a problem with their respiratory system. So this respiratory acidosis in infants can occur the lung when their lungs are not able to remove enough carbon dioxide from their body. So, resulting in an increase in the concentration of carbonic acid in the blood and a decrease in blood pH. So, our normal range of blood pH is 7.35 to 7.45, which if it gets low, it will result in acidosis, and if it gets high, it will result in alkalosis. So, excuse me. Wait lang. Okay, so the partial pressure of our carbon dioxide, or the normal range of it, is just 35 to 45 milliliters of mercury. Okay, so pala nag-slide. So the signs and symptoms of respiratory acidosis um in infants is rapid breathing or shallow breathing, cyanosis or bluish discoloration of the skin, cyanosis because the airway obstruction of airway obstruction. Yan. So increased heart rate, low blood pressure, fatigue or lethargy, poor feeding or decreased appetite, irritability or restlessness, and lastly is the altered consciousness or decreased level of consciousness. So, the causes is the respiratory distress syndrome, or the RDS. Ito yung condition na when the premature infants where their lungs are not fully developed and are unable to produce enough surfactant, a that yung surfactant is a substance that helps to keep the lungs inflated. So, next is the chronic lung disease. Alam niyo naman na yan, di ba? Yung chronic lung disease is yung ito na talaga yung malalang lung disease ng infant. So, yung airway obstruction is ito yung condition na ano ba to? Yung nabablock yung airways nila and nagkakos ito ng ng respiratory acidosis. Kaya nga, yun nga yun. So, oo nga. So, next is the pneumonia. Pneumonia. Alam niyo na to, di ba? Ito yung infection sa lungs na nagkakas ng inflammation and ano pa yun? Impaired lung function na nagli-lead sa respiratory acidosis, congenital heart disease, birth asphyxia, and hypoxia. So, the lab test, yun nga yung arterial blood gas or the ABG test to measure the level of carbon dioxide and oxygen in the blood. Next is the complete blood count or CBC. Ito yung kinukuhanan ng dugo tapos, ayun, chinecheck nila sa lab to assess for infection or anemia, and the electrolyte panel to assess for imbalances. Yung ABG kit 1, ito yung chinecheck nila kung yung sinabi ko nga kanina yung mga normal range ng mga acid-base balance, yung partial, ano na yun? Nakalimutan ko naman yun. Yung partial pressure ng carbon dioxide, which is 35 to 45 milliliters of mercury, yung pH level 7.35 to 7.45, yung bicarbonate ions yung normal range ng bicarbonate ions, which is 22 to 26 milli equivalent per liter, and the partial pressure of oxygen, which is 75 to 100 milliliters of mercury. Doon nila chine-check kung nagko-compensate ba to as metabolic as respiratory acidosis or respiratory acidosis or alkalosis, or the metabolic alkalosis or the acidosis. Yun. So, the pathognomonic features of respiratory acidosis is decreased pH levels. Ito yung sinabi ko kanina, di ba pa nag-decrease siya, acidosis. Decrease. So, less than 7.35 on arterial blood gas testing. Increased carbon dioxide levels greater than 45 milliliters of mercury on ABG testing. Bicarbonate levels that may be normal slightly elevated. Yun, explain ko na kanina yun. So, next is the therapeutic management. Early recognition and treatment of underlying conditions of respiratory acidosis. Prompt administration of oxygen therapy and mechanical ventilation if needed. Kasi nahihirapan sila mga kaya kung kailangan nating administer yun agad-agad. So, pharmacologic interventions to improve breathing and decrease the workload on the heart and lungs. Supportive care, including hydration and nutrition. Siyempre, kailangan maging healthy para maiwasan yan. And close monitoring of the neonate's vital signs and response to treatment. So, mahalaga tong close monitoring ng neonate's vital signs kasi kasali dito yung oxygen, yung blood. Siyempre, di ba, yung pulse natin, pag bibilis siya or bumabagal, yung oxygen kung bumababa siya o tumataas. Kaya, importante talaga yung vital signs dito sa acid-base balance. So, the nursing intervention naman dito is monitoring the vital signs, yun pa rin, so such as heart rate, respiratory rate, and the blood pressure. Administering oxygen therapy as prescribed by the healthcare provider. So, wag tayo mag-administer ng oxygen pag hindi piniprescribe ng healthcare provider kasi bawal tayong nang walang utos galing sa doctor. So, assisting with mechanical ventilation if needed, positioning the neonate to improve breathing and oxygenation, administering medications as prescribed, such as bronchodilators or diuretics. So, providing supportive care, including hydration and nutrition, educating Excuse me. So also educating the parents on how to care for the neonate at home. So the pharmacologic interventions naman dito is bronchodilators to open up the airways and improve breathing. Diuretics, also to remove excess fluid from the body and decrease the workload of the heart and lungs. So last is the antibiotics to treat underlying infections. The health teachings is signs and symptoms of respiratory distress. Dapat i ipaliwanag natin to sa parents or the tawag dito, yung nag-aalaga sa kanya kung ano ba yung mga signs and symptoms ito para 'pag kunyari, if it happens na ma ma-sight nila na ito yung na nangyayari yung mga signs and symptoms na sinabi sa kanila is masabi nila 'to agad at maagapan yung sakit ng neonate. So, proper administration of oxygen therapy, proper feeding techniques including pacing and burping, proper positioning to improve breathing and oxygenation. Lastly is home monitoring of the neonate's vital signs. So, laging may vital signs dyan. So, next is the respiratory alkalosis. Saan na yun? Next pala. So, dito naman is when there is a decrease in the amount of carbon dioxide in the bloodstream due to excessive ventilation of the lungs. So, yung infant, nade-develop na itong respiratory alkalosis na ito yung higher than normal blood pH level caused by a decrease in carbon dioxide levels in the blood. So, ito yun. Yun nga yun. Yung sinabi ko kanina. Hindi ko na ulitin kasi alam niya naman na yun. So, yung signs and symptoms nito is rapid or shallow breathing, cyanosis or bluish discoloration of the skin, increased heart rate, low blood pressure, muscle twitching or spasms, altered consciousness or decreased level of consciousness. So, halos pareho lang sila ng acidosis ito kasi hindi balance yung kanilang carbon dioxide sa lungs. So, ganun, may problema pa rin sila sa paghinga. Magiging cyanosis pa rin kasi 'di ba nga sabi nga nila nung pag may problema sa breathing, ket diyan malalaman kung cyanosis siya is may problema sa paghinga. Next is the causes, hyperventilation due to anxiety or pain. So, itong hyperventilation naman is the rapidly breathing and shallowly for an extended period of time. And it, it, in, nangyayari to due to variety of reasons such as may fever yung neonate, anxiety, pain, or even excitement. Ayan, nakasulat. So, mechanical ventilation. Ito yung gumagamit tayo ng mga equipments para sa ventilation. Ay, mali! So, yan, back to the topic. Mali yung nasabi ko mechanical ventilation kasi cause pala yun. So, mechanical ventilation, tama nga, ito yung, parang namali yung paggamit ng mga equipments para sa ventilation kaya nagkaroon siya ng respiratory alkalosis. Next is the congenital heart disease, pulmonary hypertension, metabolic disorders, and the infections. Nansali dito yung metabolic disorders kasi alkalosis nga, the pH level of our body. So, kung alkalosis, ang respiratory is alkalosis, may kinalaman din dito ang base natin, which is the kidney. Na ipapaliwanag mamaya ni Micaela kung bakit. So, the lab test, same lang, arterial blood gas o the ABG test to measure the level of carbon dioxide and oxygen in the blood. CBC or the complete blood count to assess the infection or anemia. Electrolyte panel to assess the imbalances. Same lang sila ng acidosis. Next is the pathognomonic features. So, kanina is less than 7.35. Ito naman is greater than 7.45, which is mataas siya kaya alkalosis ang kanyang pH level. So, natetest to by arterial blood gas or the ABG testing. So, next is the decrease of carbon dioxide levels, which is decrease of 35 milliliters of mercury on ABG testing. And lastly is the bicarbonate levels that may be normal, slightly decreased. So, dito lang naman kasi nag-aano sa bicarbonate level kasi parang dito nila um, wini-weigh kung paano siya nagko-compensate as alkalosis or acidosis. So, ang therapeutic management is early recognition and treatment of underlying condition, prompt administration of oxygen therapy and adjustment of mechanical ventilation settings if needed, pharmacologic interventions to address the underlying causes of hyperventilation, supportive care including hydration and nutrition, close monitoring of the unit's vital signs and response to treatment. Say, halos same lang. Next is the nursing intervention. Yon, monitor of vital signs ulit, heart rate, respiratory rate, and blood pressure. Assess the na unit's level of consciousness and response to stimuli. Administer oxygen therapy, adjusting mechanical ventilation ulit. So, addressing any underlying causes such as anxiety or pain, educating parents on how to care for their unit at home. Next is the pharmacologic intervention. So, sedatives to reduce anxiety and improve breathing. Carbon dioxide breathing techniques to increase carbon dioxide levels in the blood. Acetazolamide to reduce respiratory rate and increase carbon dioxide levels. So the health teachings for respiratory alkalosis is look for the signs and symptoms of respiratory distress, proper administration of oxygen therapy, proper feeding techniques, including pacing and burping, proper positioning to improve breathing and oxygenation, home monitoring of the neonate's vital signs. So, next reporter is Micaela Castañeda for the metabolic acidosis and metabolic alkalosis.
Naririnig ako. So, yung metabolic acidosis, next slide. So, ang metabolic acidosis, a condition known as metabolic acidosis occurs when the body fluids contain excessive amount of acid. So, ang metabolic acidosis is an acid base. Hindi ito isang disease. Ito ay isang biochemical abnormality and also metabolic acidosis has non-specific clinical manifestations and it can be mistaken for both common and uncommon disease. So, yung mga common disease gaya ng diarrhea, heart disease, hepatitis A, malaria, dengue fever, and so on. Tapos yung and also the uncommon disease, the auto-Reweri syndrome, foreign accent syndrome, and congenital insensitivity to pain. Then, and also in pregnancy, the growth and development of the fetus may affected by metabolic acidosis. Metabolic acidosis may impair fetal circulation, which could result in fetal distress. So, gaya nga ng sabi ko, it can ang normal human psychological pH is 7.35 to 7.45. Sabi nga ni Laika, and pag decrease 7.35. So 7.35 to 7.45, a decrease in pH below this range is acidosis. Then yung increase naman is 7.45. So over this range is alkalosis. So yung sinasabi dito na fetal circulation, a condition caused by systemic circulation at pulmonary circulation. Na nagko-convert mula sa antennal circulation pattern hanggang sa normal pattern. Yung normal pattern is the right side of the heart has higher pressures than the left side of the heart. Yung fetal distress or death naman is ito yung sign that the infant is not feeling well kapag mayroong fetal distress. Nangyayari ito kapag yung baby is kulang yung nakukuha niyang oxygen through placenta. So, fetal distress can sometimes during pregnancy, ngunit mas karaniwang itong nangyayari sa panahon ng panganganak. So, next slide. So, the signs and symptoms are nausea, vomiting, poor feeding, weight loss, failure to thrive and rapid deep respiration, poor feeding, lethargy, tachypnea, decreased urine output, and hypotension. So, halos same lang sila sa respiratory alkalosis and acidosis. So, next slide. So, yung causes is inadequate oxygen supply during delivery. So, kapag hindi nakakatanggap ng sapat na oxygen ang baby during childbirth, it can result acidosis dahil sa pagbaba ng pH ng dugo. Then yung poor perfusion. Yung poor perfusion, kung mayroong problema sa pagdaloy ng dugo o blood flow sa katawan ni baby, pwedeng magkaroon ng metabolic acidosis dahil sa pag-accumulate ng mga acids sa dugo. Then yung underlying conditions such as renal tubular acidosis. So, ang renal tubular acidosis ay isang condition in which kidneys are not able to remove acid from the body effectively. Kung mayroong ganitong kondisyon, maaring mag-accumulate mga acid sa katawan at magdulot ng metabolic acidosis. So, inborn errors of metabolism. So, may occur due to problems in metabolism that are present at birth, tulad ng mga enzyme deficiencies. Kapag hindi sapat ang kakayahan ng katawan na mag-metabolize ng mga acid, maaaring mag-accumulate ito sa katawan at magdulot ng acidosis. So, last is sepsis. So, yung sepsis is condition kung saan mayroong nakakapasok na mga bacteria or microbes sa ating body. Body lalo na sa mga baby. At ito ay nagdudulot ng malubhang infection. Kapag mayroong sepsis is maaaring magkaroon ng metabolic acidosis sa mga chemical na nabubuo mula sa nakakapasok na mga mikrobyo o nagdudulot ng acidosis sa katawan. So, yung mga lab test, arterial blood gas analysis. So, ito yung measure the balance of oxygen and carbon dioxide in your body to see how well your lungs are working. So, serum electrolyte levels. So, Ito yung test na measures levels of the body main electrolytes. So, serum lactate level, measure the amount of lactic acid in the blood and the fairly sensitive and reliable indicators of tissue hypoperfusion and hypoxia. Then yung measure of electrolytes, measure kung saan nakikita at ang mga concentration of the substance in a specific amount of blood. So yung BAN or blood urea nitrogen test can provide important information about your kidney function. Yung creatinine naman is test done to see how well your kidney work. And serum glucose level as well as urinalysis. So yung serum glucose level, this measure your blood sugar after overnight fast, not eating. Fasting blood sugar level of 99 mg per dl or lower is normal 100 to 125 mg per dl. Indicates that you have prediabetes, and 126 mg per dl or higher indicates you have diabetes. This measure your blood sugar often after an overnight fast. Yun lang. Then yung urinalysis is yung pagdetect ng marriage-wide range disorders such as urinary infection, kidney disease, and diabetes. Yung pathognomonic signs. Next slide ka. Yung pathognomonic signs is metabolic acidosis is whose mouth respiration. So yung small respiration ay tinatawag na malalim at mabilis na paghinga. Yun, mabilis na paghinga. Then ito ay isang senyales na nakikita sa pasyente na may metabolic acidosis and kailangan nating mag-release ng sobrang carbon dioxide sa ating katawan upang maiwasan ang pagtaas ng acidity sa dugo. And it is important na malaman agad para maagapan o matukoy kapag may metabolic acidosis ang isang tao. So, next. So, yung therapeutic management, tromatimine, also called some or tris hydroxymethyl aminomethane. So, ito ay is a buffer that can use to treat acidosis when concerns exist regarding carbon dioxide accumulation from the metabolism or administered sodium bicarbonate. Next. Next na. So, yung nursing intervention, assessing the neonates fluid and electrolytes. So, fluids and electrolytes plays a vital role in homeostasis within the body by regulating various bodily function, including cardiac, neurooxygen, acid-base balance, and much more. Then, monitoring the neonates' vital signs including birth. So, dito, para ma-assess yung blood pressure niya, kung mataas ba yon o mababa para maagapan agad. Then, administering intravenous fluids and electrolytes as ordered. So, is an effective and fast-acting way to administer fluid medication treatment in an emergency situation. and for the patient who are unable to take medication orally. Then assessing the neonate's mental status and neurological function. So, newborn neurological assessment is a part of the thorough evaluation of the newborn that performs within 24 hours after birth. So, the goal is to confirm the normal neurological status and early detection of treatable condition and yung mga condition that might affect their development. Then providing appropriate nutritional support. Next. So, pharmacologic intervention lang. Neonates may include administration of sodium bicarbonate, which can help to correct acid-base imbalance. However, the use of sodium bicarbonate should be carefully monitored as it can lead to complications such as hypernatremia and Hoy, mamaya muna yung baby time. So, yun nga, as it can lead to complications such as hypernatremia and fluid overload. So, next. So, health teaching. It is important to seek medical attention immediately. The underlying cause of the condition will need to be identified and treated in order to restore the body acid-base balance to prevent further complications. So, kailangan agad nating magpa-check up kung may mga nararamdaman tayong sakit para hindi na to lumala or mag-leads ng complication. Next slide ko. Next slide. Metabolic alkalosis. So, is a condition that occurs when there is an excess of bicarbonate in the blood, leading to an increase in pH. It can occur in neonates and infants, and it is common electrolyte disturbance in this population. So, ang high level of bicarbonate sa ating dugo ay maaari mula sa metabolic alkalosis. This is the condition that um, na nagdudulot ng pagtaas ng pH. pH sa tissue natin. And also, metabolic alkalosis can happen from loss of acid sa ating katawan, such as through vomiting and dehydration. So, ang metabolic acidosis involves a primary increase in serum bicarbonate ion concentration due to loss of hydrogen ion from the body, or a gain in bicarbonate ion as a compensatory mechanism. Metabolic alkalosis can lead alveolar hypoventilation with a rise in arterial carbon dioxide tension measured in partial pressure of carbon dioxide in arterial bed, which diminishes the change in pH that would otherwise occur. Next. So, yung signs and symptoms is irritability, muscle twitching, or cramping. Excuse me. Yung muscle twitching or cramping, sometimes we experience muscle twitching or cramping kasi na-overuse yung muscle natin or na-over-exercising. Then, cause, sabi dito, kat yung dehydration and lalo na yung stress. Then, weakness or fatigue, vomiting or diarrhea. And also the respiratory distress. So, yung respiratory distress is a serious lung condition that cause low blood oxygen. So, yung signs ng mga respiratory distress is fast breathing, fast heart rate, fever. Next. Causes is excessive loss of too much acid through vomiting. So, metabolic alkalosis can occur when a person vomits excessively na nagdudulot ng loss of stomach acid which is acidic. Ang pagkawala ng acid na ito ay maaring magpataas ng pH ng dugo, making it more alkaline. Then, use of diuretics. Ang mga diuretics ay mga gamot na nagpapataas ng urine output which can lead loss of electrolytes tulad ng chloride at potassium. And this loss of chloride can result metabolic acidosis. Then yung ingestions of excessive amounts of antacid. So, ang antacids are medications na nag-neutralize sa stomach acid which can help to relieve heartburn and acid reflux symptoms. But ang sobrang paggamit ng antacid ay maaaring magdulot ng metabolic acidosis dahil sa pagbaba ng stomach acid na and nagre-result ito ng decrease in chloride levels o pagbaba ng chloride. So, congenital chloride losing diarrhea. So, ito ay isang rare genetic disorder na nagre-resulta sa matagal na pagtatae or chronic diarrhea na maaaring magdulot ng loss of electrolytes including um, chloride. The loss of chloride can lead to metabolic alkalosis. So, yung rare genetic disorder such as Bartter syndrome. Yung Bartter syndrome is a rare genetic disorder rin na nakakaapekto sa kidney natin na ability to mag-reabsorb ng salt at mga electrolyte including chloride. And nagdudulot din to ng metabolic alkalosis. Next. Yung lab test is arterial blood gas, EBG analysis. Serum electrolytes, urine electrolytes. Same din lang sila ng metabolic acidosis. Next. So, there are no pathognomonic features specific to metabolic alkalosis in neonates. However, the presence of respiratory distress or severe electrolyte imbalance be can be indicative of severe metabolic alkalosis and can prompt immediate medical attention. Next. So, therapeutic management, correcting fluid and electrolyte imbalances, monitoring the infant's vital signs, and treating any underlying medication. So, this may include administering intravenous fluids and antiemetic medication or involving a pediatrician or other healthcare professional. Next. So, sa nursing intervention, the most important, ang hindi nawawala ay monitor BP, monitor heart rate and rhythm lang. Observe for altered respiration, exertion rate, and depth. Tapos yung assess skin temperature, color, capillary refill, and auscultate bowel sounds, measure abdominal girth as indicate. So, dito ka, in the presence of coexisting hyperkalemia, GI distress, gaya ng distensions, diarrhea, and colic may occur. So, test and monitor the pH urine. So, kidneys attempt to compensate for acidosis by um, excreting excess hydrogen in the form of weak acids and ammonia. Next. So, pharmacologic intervention. In cases where medication is necessary, the following drugs may be used. So, ito carbonic anhydrase inhibitor. So, example dito kat yung acetazolamide. So, yung mga common patient with respiratory failure and may delay weaning and mechanically ventilated patients. Carbonic an anhydrase anhydrase inhibitors helps to block renal bicarbonate. So magre-reabsorption and thus reverse metabolic alkalosis. So yung meron din dito yung potassium sparing diuretics. So na-discuss to ni Jillian kanina. So potassium sparing diuretics, it's example ko dito yung aldactone. So yung medicines that increase diuresis, urination without the loss of potassium, potassium and also and also the potassium sparing diuretics are used to so block this effect. More sodium and water can pass into the collecting ducts of the kidneys, increasing diuresis. Next.
At next.
So health teaching, the importance of monitoring their infant's fluid intake and output. The importance of taking their infant's medication as prescribed. So dito kailangan nilang sundin yung prescribe ng doktor kasi kapag hindi parang mawawala yung bisa ng gamot. Ganun. The signs and symptoms of metabolic alkalosis in neonates and when to seek medical attention. The importance of regular follow-up appointment with their healthcare provider. The importance of proper nutritional support. Meron pa? Thank you! Momo chup chup. Ito ah.
Ulitin mo.
Oh, tangina mo, ikaw na, matutulog na ako.
Ma'am, uno daw kami dito sabi ni Mika.
Ma'am, uno. Kahit ang bobo. Ikaw, bebe time ka ng bebe time. Oh, so, nag-aaral pa ako. My bebe loves.
Ako ba naglagat?